Today I will be presenting a One Health Systems perspective on Outbreak as Greenfield farms. Rather than viewing this as a single source outbreak, I will focus on how human, animal, and environmental factors interacted and contributed to what was ultimately a preventable zoonotic event. What makes this case particularly important is that it's not a simple or textbook outbreak. Instead, it reflects real-world complexity where multiple transmission pathways exist at the same time, and different systems interact in ways that amplify risk. Human, animal, and environmental health are closely interconnected here, creating a high-risk interface. So this case helps us better understand how zoonotic diseases actually emerge in real-world settings. One of the key ideas in this case is that it was not an outbreak, but a system failure. There wasn't a major mistake. Instead, multiple smaller breakdowns across agriculture, environmental management, and public health accumulated over time. Each vulnerability fed into the next, and because these risks were interconnected, they amplify each other. So instead of looking for one cause, we need to understand how the system as a whole failed. In this case, Salmonella enteritidea is the underlying pathology linking all transmission pathways, spreading through contaminated food, water, and environmental exposure. When we map the transmission pathway, we can see the exposure occurred through multiple routes at the same time. There was direct foodborne transmission through contaminated milk. Environmental contamination occurred through manure runoff. There was community exposure through contact with contaminated water, and there was also a food chain pathway involving poultry. What's important is that these pathways do not act independently. They enforce one another and amplify transmission across systems. So this becomes a feedback system rather than just a single pathway. Animals play a central role as the primary reservoir of infection. Infected cattle, particularly those with mastitis, likely shed salmonella into milk supply, creating a direct route of human exposure. Poultry acted as a secondary reservoir, increasing transmission complexity, and importantly, early warning signs were missed due to lack of integrated surveillance. So animal health is not just about livestock management, it is directly connected to public health outcomes. Humans' behavior also play an important role in shaping exposure. This includes hygiene practices as inadequate hand washing, contaminated equipment, and poor handling of raw material, such as raw animal products, can increase transmission risk. Consumption of unpasteurized milk bypass standard food safety protection. Farm workers experience direct occupational exposure through daily contact with infected animals and contaminated materials. And community members use the contaminated stream of recreations without awareness of the risk. So in this case, behavior is part of the transmission system, not separate from it. The environment acted as a key bridge connecting animal infection to human disease. Untreated manure introduced pathogens into the system. Heavy rainfall then mobilized those contaminations through runoff into the streams, and the streams serve as a shared resource for both agriculture and community use. So the environment was not just a passive background, it actively enabled transmission. A One Health response requires identifying all stakeholders involved, not just the obvious one. This includes farmers, farm workers, the local community, public health officials, veterinarians, food regulators, consumers, and policymakers. Each of these groups influence either risk or response. And importantly, these stakeholders may have competing priorities. For example, farmers face economic pressures while public health agencies prioritize safety. So coordination across sectors is essential, but also challenging. What actually went wrong here was not one major failure, but a combination of smaller vulnerabilities. There was no manure treatment. There was weak separation between the farm and the community. There was a lack of cross-sector coordination, and there was communication gaps around raw milk risk. Individually, these might not have caused an outbreak, but together they created the condition for escalation. Once the outbreak was identified, immediate actions focused on reducing ongoing exposure. These actions aim to control the spread of Salmonella as its source while also reducing human exposure. This includes halting raw milk sales, treating infected animals, restriction access to contaminated stream, and issuing public health advisories. Additional measures include reinforcing hygiene practices such as proper hand washing, use of protective equipment, and safe handling of animal products. These interventions were designed to interrupt transmission across all pathways simultaneously rather than targeting a single source. Long-term preventive requires structural changes, not just short-term fixes. These include early detection of pathogens such as Salmonella through routine animal and environmental testing. It also involves implementing manure treatment systems, creating buffer zones between farms and communities, and developing integrated surveillance systems. Education is important, particularly around risk perception and behavior. Ongoing training in hygiene and safe handling practices is essential to reduce long-term occupational and foodborne risk. And environmental surveillance, such as routine testing of nearby water resources, can help detect contamination early. These strategies are mostly effective when they are implemented together across systems. Looking ahead, there's a shift from reactive to predictive approaches in One Health. This involves using environmental signals such as rainfall and runoff patterns, animals' health data as early warning indicators. By integrating these signals across sectors, it becomes possible to identify risk before human cases appear. So the goal is not just to respond to outbreaks, but to anticipate and prevent them. This case highlights that no single discipline can fully understand or manage an outbreak on its own. One Health makes these interconnections visible. At the same time, aligning different sectors can be difficult because they operate with different priorities and timelines. These cases reinforce that outbreaks are not just medical events, but system-level failure that require coordinated solutions across disciplines. To conclude, this outbreak did not happen because of one mistake. It happened because multiple risks were present, systems were disconnected, and communications broke down. Prevention requires recognizing these layers, risk, connecting systems, and integrating efforts across disciplines. The One Health approach shifts the focus from reacting to outbreaks toward preventing them by addressing the system as a whole.